Hey everybody, Dr. Barron here with virtualheadacheспecialist.com. I see a lot of people that come in, they have a story that is very suspicious for a CSF leak, a spinal fluid leak. They have symptoms that are very suspicious. They have a brain MRI that shows some suggestion of low pressure in the spinal fluid, sagging brain, these things that we look for in scans. I did a video a couple back, if you scroll back, on CSF leaks, if you want to hear more detail about the symptoms for these. But these people come in and you think you're going to find a leak, and so the person has the spinal MRI with CSF leak protocol, comes back normal. They have a CT myelogram, comes back normal. And so you're stuck with these cases that the story suggests a CSF leak, their brain MRI suggests it, but everything else is coming back normal. So historically, these people have been kind of stuck in a place without a good answer for a long time. But there's a newer test called a DSM that you want to ask your doctor if they can do. Digital subtraction myelography. It's a very specialized type of CT myelogram. It's done in a more complicated way, but it gives you a much more vivid picture looking for very subtle leaks, slow leaks, things called CSF venous fistulas, small tears in the dural membrane. And so there's not a lot of places that can do this. Cleveland Clinic, Duke, Mayo, Hopkins. There's probably some others out there too. Those are, top of my head, the ones that I can think of. But you want to ask your doctor if this is something that they could refer you to if they don't have it at your facility, because it can be a game changer at actually localizing the leak. I had 2 cases in the past month alone. Patients had symptoms that were really suggestive of a low pressure headache. Their MRI of the brain showed suggestion of this, but everything else was coming back totally normal. And so we did DSMs on these patients, and here are the results of these 2 cases.
Here's one case where there was a very teeny little tear in the dural membrane in front of the spinal cord. And you can see, I'm circling here, the spinal fluid was slowly seeping out where these 2 arrows are showing. You can see this line, this dark line right here. This is spinal fluid slowly seeping out that was not seen on any other imaging. This was the case of a CSF venous fistula. You can see this looks like a dark upside down V. This was actually CSF that was seeping out of the spinal canal and into a nearby vein. So it's called a CSF venous fistula. And so this was the source of a leak in this patient. Again, all of their testing was negative, including CT myelogram.
So if you're having ongoing symptoms of a CSF leak, that positional headache comes on really bad when you stand up, goes away when you lay down, all the other symptoms that go with a CSF leak. If your doctor thinks you might have a CSF leak, but all the testing's coming back normal, except for maybe the brain MRI showing some signs of this, ask your doctor if they can do a DSM, digital subtraction myelography. Hopefully that will get you some answers to whether you have a leak or not.